The statements and opinions expressed in this episode are those of Dr. Sigman and his guests, and do not necessarily reflect the views of Veradigm.
It's time to do healthcare smarter. This is Smart Medicine, hosted by Dr. Scott Sigman and powered by Veradigm. Think about your favorite robot for a minute. Maybe it's R2-D2 or Optimus Prime. Now picture one of them standing over you in the operating room with a scalpel. Look, I can only imagine that picture has you wondering this question. How close are we to that reality? I asked that exact question to our guest today. I'm joined by Dr. Catherine Mohr, president of the Intuitive Foundation, an engineer, surgeon, and innovative leader in surgical robotics. In this episode, we explore the past, present, and future of robotic surgery, from training the next generation to telesurgery across the oceans. Turns out our future is a little less R2-D2, and in reality, a little more like the $6 Million Man. Welcome to the Smart Medicine Podcast. I'm Dr. Scott Sigman, and today I have the privilege of welcoming Dr. Catherine Mohr. Her work bridges the gap between science and humanity, the essence of smart medicine. Catherine, we're thrilled to have you with us on the show today.
Real pleasure to be here, Scott. Thank you.
So before we dive in, I really want to share your background. It really is quite extraordinary. You have a degree in medical engineering from MIT. My father is a proud Beaver, chemical engineer from MIT in the 50s, a medical degree from Stanford. And your career has taken you through aerospace, alternative energy, medical devices, really a very incredible spectrum. So how have those experiences shaped the way you think about healthcare innovation today?
One of the things that I often tell young people who are trying to figure out, what is it that I should do? And they're trying to plan their whole career, is that it's okay to keep changing. And each stage is a tool or more tools that you're putting into your toolbox. I've been collecting tools along the way, and often it gives you the opportunity to look at something from a very different perspective from the way someone who's been trained entirely in one discipline. And so maybe it's a bit self-serving in that I'm saying that I can't stay doing one thing is a feature rather than a bug. But for me, it's always, how do you pull the elements of each one of these experiences that you have and bring them to the table for problem solving of the kinds of wicked problems that I like to tackle.
Those are big problems, and life is all about relationships, and each one of those areas speaks their own language. So to be able to communicate across those different areas, cross-pollination, if you will, I think is what really oftentimes creates revolutionary ideas, not just adjacent innovation. And so your perspective on innovation really sets the stage for some important challenges in global health. And especially when I think of global health and surgery, there are surgical deserts around the world where even some of the most basic procedures, appendectomies, cholecystectomies, et cetera, are still unavailable in many regions. And so at the heart of, I think, of your work, we think of access, right? Robots we'll get to as well. But with still so many people seeking and needing safe surgical care, how do you see the role of humans and technology coming together to help bridge that gap?
We're at an exciting point where being able to realize the kinds of programs that we're trying to make is being accelerated by some of the generative AI tools that we can use to get there. And this is allowing a large number of clinicians who are used to teaching in a one-on-one kind of a scenario to be able to teach one to many. We're using these tools to help us create the materials that will allow the scale. So, but when we're thinking about teaching someone a surgical procedure, you need to be able to practice the physical aspects of it, the psychomotor skills associated with it. And as clinicians, how we do that is we do it on our own under supervision. And so what we're doing fundamentally about surgical access is if we could get someone to be able to learn the physicality of that procedure, not just the book learning aspects of it, on their own with appropriate coaching so that they don't sort of pick up erroneous skills. And they can do that at the point of care. They can do it in an isolated hospital wherever they happen to be in the world. So we're focusing on scaling by not pulling everybody together into a central place to train, but by making that really excellent training available anywhere they happen to be.
Just a short window of time and the exponential acceleration of technology is really quite remarkable. We're going to get to that because I want to talk to you about who should be our clinicians moving forward. Let's move again into the technology a little bit. Let's focus on combining human ingenuity with technology. And really, in the modern medicine world, that's robotics. And you really are an expert in robotics. And surgical robotics are everywhere. So let's talk a little bit about that, because not all robots are the same. And you've been involved, obviously, with Da Vinci. So what area of medicine do you see experiencing the most innovation in robotics moving forwards? And are there specific systems or technologies that are getting you excited?
We've seen a lot of explosion that you referred to in soft tissue robots, the Da Vinci really being the flagship for that came out and said, how do we do a laparoscopy analog? In parallel, Robotic, which was the hip replacement, the orthopedic robot, predates the Da Vinci.
Can I tell you a funny story?
Sure.
I was in the OR at the New England Baptist Hospital, probably in 1994, when we moved in that little Volkswagen Bug, the Robotic, and literally all it did was sort of core out and ream the femur. And I was just like, amazing that technology was in its infancy at the days and where we are today.
While we think of robots as relatively recent, we're talking about the 1990s. There was also a neurosurgery robot back in those days called the Minerva. And it had a ring that you put on the patient's head, and it was guidance into the brain. But we saw an explosion in the soft tissue robots. The fundamental premise of that is the incision serves no therapeutic purpose. That it's what you're doing inside the body that is causing the cure. And if you can minimize the access into the body and do innovative things inside and be curative without a big incision, that's the big idea. In orthopedics, the big idea was not about minimally invasive, it was about accuracy. And if we can improve the accuracy, we'll be able to improve the patient outcomes, because an implant that's put in incorrectly isn't really going to do the patient what we'd intended. There's still a big gap between what the clinician wants to do for the patient and what they can do for the patient. And we fill that with technology. So this is a prelude to where am I excited about things coming out. When we put the Ion robot out there, this is a catheter-based robot that you can snake down through the bronchial tree and you can get out to tumors that are right out at the edge of the pleura. The gap we were trying to close at that point was the ability to diagnose something that's cancerous while it was still in a curable stage. There, it was less about the invasiveness and more about, could we move the timeline? So when we look at some of the new things that are coming out, I see a lot working in dental, where can you place a crown or in the regular dentist's office so that you can place a post and be able to put a tooth implant all in a regular dentist's office. And I like that one because the gap for the patient, they're still getting the same procedure, but they're doing it with one practitioner. So when I think about those gaps, the gap there was embarking on getting an implant would take multiple visits, multiple days, a lot of time off work, more expensive, and bringing it all into, we're just going to fix that tooth for you and it will be done. I see this with a lot of the new things that are coming out in ophthalmology, where there have been a lot of companies that have looked at doing clear lens exchange. putting something that's still pliable for an intraocular lens replacement. But the techniques necessary to do that and the likelihood that you would injure the eye have always kept this kind of technology out of common use. But if we could bring, in this case, precision and micromanipulation into eye surgery, we start to be able to bring some of these technologies that would let us all throw these glasses away and bridge that gap between, again, what clinicians and patients want for themselves and what we can do. And so thinking about evaluating all of these different robots that are coming down the pipe in terms of what's the gap that they're looking at addressing, it is, I think, a very useful way to think about what excites you.
So I was really surprised that the examples that you picked are super practical. Eyeglasses, crowns, things that are really important to people on a day-to-day basis that really can have emphasis almost immediately. So I was just at a meeting. I was in San Francisco last weekend for the Doc SF meeting. Our mutual friend, Josh McCower, was there. We were on a panel together for sports medicine innovation. And one of the young surgeons sort of raised his hand and really made a really fascinating observation to us. We were talking about robots, but he was like, it's just not fun. I want to be able to operate. I want to be able to do things. For Da Vinci, for the soft tissue robots, you're literally in there. You're operating. Your hands are doing, the robot's moving, but it's your brain, it's your hand movements that gets translated through to the robot. From your perspective, what does the true human-machine synergy look like today?
Well, my heart goes out to that poor orthopedic surgeon because operating is fun. I mean, it's a serious business. It's really important to the patient, but there is something so electric and alive about operating. And so that he's feeling that, and I'm sympathetic, that you feel a bit like you're coloring in a stencil when you actually want to be creating a drawing. I think in the soft tissue, it is more free-flowing because you cannot predetermine where you need to cut. It is always going to be that interplay between the surgeon looking at the material, looking at the tissue, making an intraoperative decision, and deciding upon the next step. Whereas it's a bit more deterministic when you have hard tissue and you can map it out ahead of time, which means you decided the steps before. I don't think the dental ones will feel this satisfying. I think they will be, you're again being held to a particular trajectory in order to put the post in order to be able to place that implant. But it may be someone who's never done that kind of work before, and it will still feel novel to them, as opposed to someone who's trained over and over again to be able to place those posts, feeling like this makes it boring for them. You may be able to take people that have not spent all of that time learning how to place those posts and give them a new capability, which will feel exciting. I think it's kind of where you're coming to or where you're coming from.
It's incredible to see how far robotics has come. The real story isn't about robots replacing surgeons. It's about humans and machines working together. Think of robotics as giving surgeons a precision boost to what they already do best. Robots can extend our reach, steady our hands, and help us unlock levels of accuracy that were once impossible. I'm sure you're wondering, what about the patients? That's exactly where we're heading next. This episode of Smart Medicine is powered by Veradigm. If you're a provider, payer, or life sciences leader looking to harness technology and data to drive smarter healthcare, connect with the team at Veradigm. So my mother Judy is listening. We always share her perspective and when it comes to patients in particular. So let's get them into the conversation here as well. So if you're a patient, you're about ready to undergo surgery. You've listed a number of different subspecialties and the way in which robots are being used. How do we explain to the patient how what the surgeon's doing and what the robot's doing to sort of provide reassurance as to what the synergy is between what's happening in the operating room?
I think the benefits that I have been talking about of the different kinds of robots would be where I would start, which is you need a procedure so that we can cure or debulk or whatever it is that we're going to be doing inside. So we can excise this tumor. I'm going to use a robot so that I can be as precise as possible around it, but also so that I only need to go in through very small incisions, because those small incisions only impede your healing. And if I didn't use the robot, I would potentially need to open with a much larger incision to do exactly the same operation on the inside. So I use the robot for you for these small incisions. That kind of a conversation is, I can do something as a clinician that I can't do any other way with the same degree of excellent outcomes for you as the patient. And that's why I'm using the robot, but I'm still doing the surgery. And my grandmother would like that.
We've been talking about human, machine, and synergy. So let's talk to the next generation. So how do we thread the needle in teaching young surgeons to still have to learn how to operate? They were complaining that we're not operating the way we used to. And if the robot's not working, what am I supposed to do? Am I going to learn how to do this? For today's surgeons who are still unsure about robotics, and for tomorrow's medical students entering this new sort of hybrid era, well, here's my question for you. And what will training look like for our future surgeons? I mean, right now it's IQ, it's your MCAT. How many things can you memorize in a day? And then we sort of give you all these books and then off you go and you start taking care of patients. But should we be doing dexterity testing? Should we be doing digital IQ? How good are you working with computers and machines and software? What's the education for our next generation of doctors going to look like?
So a lot of the training that I'm doing these days with the foundation is not based in high-income countries. It's looking at how do we close this gap between the huge patient need out there and our ability to be able to produce high-quality surgical practitioners. Again, I'm moving away from surgeons because 60% of surgery in Africa is not done by somebody with the title surgeon. And so we really need to be thinking in terms of across the whole spectrum of who is doing surgery. Often we're finding that of the people that we're training who are picking this up on their own, they're excellent technicians. And they learn to do these procedures extremely well. And we're filling in the clinical knowledge around the outside so they know when to do it and when not to do it. It's completely backwards from the way we train. We all unfortunately know the surgeons that get nicknamed the hands of death. The people who brilliant people, really know their way around and just aren't very good. By the time that was being realized, they were so far down their training, it's very difficult to fix that. And so I believe that we can learn from what we've been doing in trying to address this larger global crisis. In some of the insights that are coming from that, we may really want to pull over into our American and European surgical training systems.
So let's talk a little bit more sci-fi here. And I think one of the more exciting areas when it comes to robotics is perhaps the application of telesurgery. Not a new idea. In 2001, Operation Limburg, I guess there was a surgeon from New York that operated on a patient in France. So how do you define telesurgery? You're an expert in this area. And how has it evolved since its early days? How possible is it this going to be really a part of everyday practice for these areas in which we have fewer surgeons in underserved areas around the world?
So let's start with the definition. So telesurgery is, in the working definition, we're using a surgeon at some kind of an input device and output they can see and they can manipulate. And the manipulations that they are doing are being transmitted a fairly far distance to a robot that is performing those manipulations on a patient. And the reason why I use the far distance in there is every single Da Vinci procedure is a telesurgical procedure. If you don't put that far distance requirement in there, because the practitioner is sitting at a console, there's fiber optic cables that run between the console, and the robot is operating on the patient without the surgeon having their hands directly on the patient. And so what takes it out of a normal robotic procedure, that was in air quotes, to a telesurgical robotic procedure is this introduction of distance, really measurable distance, not just they're in the next room. So with that ends up being a whole set of issues that we need to solve technically around latency, around what happens when error packets get dropped and all of that sort of thing. But all of those are technologically solvable. Mentoring or teleproctoring is an expert sitting at a distance with all of the visibility of what's going on with the patient, but no manipulation. And so they can see things, they can speak with the primary surgeon who's at the patient side, and they can offer advice. So this form of telementoring or teleproctoring sits side by side with telesurgery. It's much, much easier to do. And the extra benefit of that is if our goal is to have the largest number of patients anywhere in the world getting access to excellent surgery, if we're telementoring or teleproctoring, the expertise is being brought over, but you're still building that local capability in that you are coaching someone through increasing their skills at the place where the need is.
To me, telesurgery is where things get really exciting. Earlier this year, in June of 2025, a surgeon in Florida performed a robotic prostatectomy on a patient in Angola. That's right, thousands of miles apart, connected through technology. And here's why it matters. Angola has one of the highest prostate cancer mortality rates in sub-Saharan Africa. Procedures like this could help close that skills gap and bring life-saving care where it's needed most. This is the promise of telesurgery, not just improving outcomes here at home, but expanding access around the world.
But you're still building that local capability in that you are coaching someone through increasing their skills at the place where the need is. And so I am very bullish on telesurgery for situations where they're at an extreme of skill. That is, it's a level of expertise that it is too big a gap to bridge with the local surgeons. And they will learn from the case, but having someone who's the remote expert actually doing it is in the best interests of the patient. So I see it as an essential element for getting people to that next level of excellence. Or we have a very complex pediatric heart surgery case that's one of those 1 in a million kind of cases. And we really want to bring telesurgery to bear in that situation. But most of the time, telementoring will better serve both the patients and the healthcare system.
I have to say that I'm relatively surprised by your practicality. I mean, I was really anticipating this potential conversation about the crazy new things that were coming down the pipeline, but the majority of your thought process is about improving the quality of care on things for now. I know that you must be working on things for the future, and that's where I want to go to. But it's really quite refreshing to see your perspective on how we can have incremental innovation with this type of telesurgery and teleproctoring moving forwards to serve humanity in a better way. So let's go 20 years into the future. What's our operating room going to look like? Are we having humanoid robots doing the surgery where the robots literally can think and have articulation in their hands and the movements of humans in doing surgery? Is that crazy talk? Where are we?
I'm not very bullish on the humanoid robot, mainly because why do operating room robots need toes? Why do they need legs? This is where you've got the engineer in me coming out that's been building things for a very long time. Everything that gets onto a robot has to earn its way on because it costs from your energy budget, it costs from your materials budget, and operating room robots don't need toes. Do they need fingers? Depends on what they're going to do. If they're going to pick up a scalpel and you're going to have all of the errors along the way of the robot and the scalpel, wouldn't you rather just have with a laser an XY ability to just completely exactly cut everywhere where you want instead of putting a scalpel in a hand? So when I think about the direction that we're going to go 20, 30, 40 years, what does the operating room look like? It doesn't have a bunch of humanoid robots walking around in it because those humanoid robots have so many features that they don't need to do the thing that they're in there for. So we've seen a rise of kitchen robots. Do they look like humans? They're actually designed to manipulate the food and present it and cook it and move it in a certain direction. They're purpose-built for the thing that they're going to be doing. So I see the future is not that we duplicate ourselves and send duplicates of ourselves in place of us, but that we build these tools that are purpose-built to do it better than we can. And then we use those and we continue to fill in the gaps with the most versatile machine that we have, which is the human being. And so as we build purpose-built stuff to make this one thing be much, much better, we just change the role of the human. We don't supplant the human. And we certainly don't make a humanoid robot.
So a purpose-built Swiss Army knife robot where every single thing inside of that robot has an important application and function. Mm-hmm. Yeah, really well said. Let's give our listeners a moment of optimism. So give us one hopeful takeaway here for the future of surgery and technology for humanity. What makes you really optimistic?
I am super optimistic that we are going to fundamentally be able to close the gaps in training. So what keeps making me excited about the future is everywhere I go in low resource environments and in middle or in care deserts inside high resource environments, people are passionate about helping other people. And if we can use technology to give those passionate people the means to help their communities, and we don't have these sort of artificial barriers in the way of it's really expensive to go off to school, but that we can put these tools in their hands and be able to give them the ability to have really good outcomes, then we've really started to solve this care deficit problem. And technology lets us do it. I think it's misguided to think we're replacing all of those very passionate people with technology. Like your surgeon who was getting bored, he wants to do something. We as humans want to care for one another. I think the technology is giving us the tools to make it easier than ever for people to care for one another in a really high quality, effective way. And that I am supremely optimistic on that.
Well, Dr. Mohr, you have given us a true glimpse into the future where innovation and humanity are moving together, not in competition, but in partnership. I love that. Thank you for your wisdom, your skill set, your humility, and the hope that you have shared today. Thank you so much for being on this episode today.
Thank you so much.
See what I mean? It is actually like the $6 Million Man. Humans and technology working together in sync. Okay, maybe not exactly like the $6 Million Man, but you get where I'm going. Dr. Mohr reminds us, it's not about replacement, it's about augmentation. When we partner with technology, we can increase access to care, eliminate surgical deserts, and build purpose-driven tools that help us achieve what we cannot do on our own. When humans and machines come together for the greater good, to me, that's smart medicine. Thanks for listening. If you've enjoyed this episode, share it with a friend who may be just a little nervous about robots in the operating room. This is Dr. Scott Sigman, signing off.